Hello, my name is Dr. Lesia Waschuk, and I'm the Compliance and Education Specialist at Prep Doctors. And today I'm going to be speaking with Sina Amiri, who is the Vice President for Strategic Markets at EDMS. And I'd like to ask you, Sina, to explain what EDMS does, and then to tell us a little bit about your background for our audience who may not be familiar with the company.
Of course. Well, first and foremost, thanks for having me today. I really appreciate it. So for those of you that have not come across EDMS, we're a data analytics software platform specifically for the dental industry. We started the journey back in 2013. My colleague, Peter Evans, who's the CEO, when he was going through the journey of looking at different practice management systems, one of the things that he noticed was that a lot of the practice management systems are not interoperable. So it's very hard if you're managing more than one location to standardize the KPIs and the data that you're pulling from these systems in order to be able to make operational decisions. So he started with the concept of being able to have these software products talk to each other. And it was through that journey that he realized he really needed to create a standalone platform that would integrate with the different practice management systems out there. So today we do integrate with 22 different practice management software, and our clients span anywhere from 1 locations all the way to 135 offices. And so we work with both solo practices as well as DSOs, giving them the data they need in order to make better financial and operational decisions.
And I understand that you have worked in a DSO previously, and today that's what our topic is for our audience to learn more about DSOs and dental corporations. And I'll be asking you some questions regarding what those types of organizations may mean for dentists at different stages of their careers.
Great. Yeah, and I've spent 15 years in the healthcare industry, so I've had the privilege of both advising solo practice owners, as well as, like you said, working within a dental support organization and seeing the differences and similarities that exist out there. And so more than happy to shed some light on perhaps if you're an associate dentist or internationally trained, what are the best paths that you can pursue in order to have a fulfilling career?
Yeah, I think that fit is important. And you've said that there are some differences between DSOs, and we also hear the word dental corporation. So maybe we can start with what is a DSO and how is that different from a dental corporation?
So dental support organization is a form of corporate model where essentially you separate the non-clinical assets and the non-dental services. And what I mean by non-dental services, I'm referring to specifically the treatment of patients. So in a typical practice that, let's say, is started by a dentist or perhaps is bought by a dentist, generally speaking, that practice has a number of different suppliers and vendors that it deals with. So you may have an HR consultant that you work with. You may have a supplier that you purchase merchandise from. You may have an accountant. You may have a lawyer. And so most of the doctors out there have these advisors that help them run the clinic. The dental support organization brings all of those services generally under one roof. Now, some dental support organizations offer a limited set of services. So you may, for example, still need to maintain some vendor relationships, right? Because that particular organization may not take care of some of the problems you may have. And so the concept of DSOs is really bringing the non-clinical services, the professional services that you would have to hire anyways, and bring them in-house. And then by contracting with the dental support organization, you're essentially paying a fee in order to benefit from those particular services. In Canada, dental support organizations are not allowed to dictate treatment, right, to patients because they're not licensed as dentists. That's why the professional corporations at each clinic do have a contract with the DSO. And at the end of the day, that dentist who's practicing with their hands dictates what treatment is delivered to the patient. And in the US, similarly, most states are not allowing non-dentists to own a clinic. There are a few exceptions. But for the most part, you cannot run a dental clinic, whether you're a dental support organization or not, from a perspective of treating patients without being licensed. And that's where you see dental support organizations hire hygienists, dental assistants, and employ through the professional corporation they have partnerships with the dentists that do end up providing the care directly to those patients. And sometimes you'll hear the terms corporate dentistry and DSOs used interchangeably. I always found it a bit of an interesting terminology classification process, because if you think about the typical dental office, the professional corporation is incorporated, right? Now that professional corporation can only be owned by the provider. And you would think that if you have, let's say, as a dentist, more than one location, well, you're hiring associate dentists in those locations. You yourself are not physically able to treat two patients in two different locations. So the same thing applies to a DSO, irrespective of the number of individual offices that they have agreements with. The chief clinical officer or the founder of a DSO may be a dentist, but they themselves cannot physically go into all these offices to perform dentistry. That's why it's important for them to rely on these contracts with the licensed professionals in order to deliver the care that they need.
So I know many dentists, they may not understand as much about the business side of things when they graduate from dental school. There are some courses about the practice administration aspect of a dental practice, but most young dentists are not quite ready to assume those responsibilities. You've talked about multi-location practices. You've talked about dental associates. So if a young, graduate, if a newly registered dentist in Canada was looking for an associateship, are there advantages to going to work in an office that's affiliated with a DSO, do you think?
So I think one of the benefits that I've seen having spent time both at a DSO as well as advising sole practice owners is, if you are new to Canada and you're not 100% sure where you want to practice long-term, perhaps you want to have some degree of mobility. The one advantage that I see with DSOs that's not easily replicated with solo practices is this idea that once you pass the interview and they want you to work with them in one of their locations, if you do well in one location, it's very easy for you to land another associateship at one of their other affiliated offices, whether it's throughout the province or all the way across the country. So there is that aspect of career mobility that you may not necessarily get working for a solo practice. Now, within a dental support organization network of practices, there is going to be a wide variety of clinics as well as a wide variety of principal dentists that are working with the DSO. And my recommendation is really define your treatment philosophy and define who you want to be as a clinician, and screen the particular offices that you may be interested in working with based on those personal values and your personal treatment philosophy. Because you may not, for example, like the fact that in a particular clinic, you have to, say, buy all of your sundries, right, or dental materials from one or two vendors. You may want to have the autonomy to dictate what materials you use as a clinician. And some DSOs decide to give the dentist full autonomy over the actual vendors that they use to purchase these dental materials from. Others restrict it to maybe one or two because they've negotiated better pricing. So if you're looking for that amount of flexibility, you may find that a DSO affiliated clinic that has a standard formulary and requires your dental assistant to only order off of the formulary, not to be conducive to the type of clinic that you want to run. And then with regards to solo practices, when you're thinking about your schedule, one of the things I've noticed with a lot of associates that are working for a solo practice is their schedule tends to fluctuate quite a bit. As we've come through the pandemic, you've probably seen principal dentists taking on more hours, coming back into the dental office, particularly because their own income may have declined, obviously, during the pandemic. And so if they're looking to make up those hours, they may say to the associate, instead of you coming here 3 days a week, perhaps there isn't as much demand for you to work those 3 days, let's cut it down to 2 days. That can also happen in a DS affiliate clinic, but because a lot of the doctors that do partner with a DSO, a dental support organization, they tend to be either mid to late career. A lot of them are looking to slow down beyond the age of 50. It's one of the things that attracts them to partner with the DSO. So you'll find that there may be much more wiggle room in terms of negotiating your schedule. And in fact, some of the associates that I've worked with that started at a DSO have seen an increase in terms of the number of hours that are required, because at some point the principal dentist decides to retire after partnering with the DSO, and they may want to transition all of their patients to the new associate. And that new associate then becomes very critical to the success of the overall organization because, without them, the DSO cannot actually generate these management fees.
So you said a couple of things that I wanted to pick up on. Number one is screen the office. And I know that when the positions are advertised, they are for specific dental offices. It's not with the corporation at large. The other thing is that I think that maybe dentists who are entering the dental marketplace may not realize that the interview really is a great opportunity to ask questions. It isn't just trying to answer in a way that you think is going to be advantageous to yourself. It's finding out whether you want to work in that particular place. So I'm really glad that you mentioned that. I know that in the US, there are some DSOs that rather than, now you're using the term affiliated with. I know that there are corporate entities that purchase practices, and I think you've mentioned that as well. And in the US, one of them that I've heard of only does startups. So if a dentist goes to work as an associate in a DSO and they hope to one day own a practice, is that a good place to be? Like they go in a DSO's affiliated office?
So it depends. You have to ask the DSO this question, which is, if I associate for one of your offices, and I say affiliated because in Canada and in the US, the current dentist who's practicing in their location generally has their own S Corp or Pro Corp, right, set up. So that professional corporation is the entity that is responsible for treating the patient through the dentist. And that entity will contract with the dental support organization, which legally cannot actually treat the patients.
Right.
So that's kind of where I say affiliation. And when I say acquisition, you often hear acquisition, so-and-so DSO acquired Dr. Smith's dental office. What they're really acquiring is the equipment, the leasehold improvements, and basically all of the non-clinical assets, right? And the right to place a dentist in that clinic to treat the patients. So they make the decision as to which dentist they hire, right? They can't put Jim Smith, who's not a DDS or DMD, in that clinic. And so if you're thinking about ownership, some DSOs do not give you the opportunity to buy into the clinic because of their corporate structure. Others do. Mm-hmm. And the ones that do generally have a very defined program where, for example, you can say purchase up to X percentage, right, of the practice. And there may even be some level of profit sharing, even if you're a minority partner. I also know dentists that have started dental support organizations whereby they will be 50-50 partners with the particular associate that they screen. And whether you decide to work with, a solo practice and you want to buy into that solo practice, or a DSO and you want to buy into one of their affiliated clinics, I think it's important to recognize that you have to prove yourself to both parties, meaning you can't go in with the expectation that they're going to want you to be owners right away. You have to earn your stripes. So what you have to think about is, if I'm going to one of these organizations and I'm presenting who I am, how can I demonstrate that I have some degree of clinical leadership? Because a lot of these DSOs are looking for clinical leaders. And the ones that are willing to have those clinical leaders own equity within the DSO need to see your abilities, not just both chair side, but can you actually lead other dentists? So if you have those skill sets, if you are a clinical leader, you make a very good partner with a DSO because they want those skill sets. If you want to be chair side, chances are you probably will not find any DSO that will necessarily, from the day that you start your associateship, make you a partner. But there is opportunities for you to earn that partnership. That could be, for example, you define a specific set of metrics that both you and the DSO agree with, such as, we need you to train the new dental assistant that is coming in because they're fresh out of school. Or we need your input in terms of how we could be doing things better operationally within that clinic. So if you're starting to act more like an owner, then it makes sense for them to make you a co-owner of the business. But if you don't have those traits, I wouldn't expect them to necessarily make you a partner, because they do have quite a wide variety of candidates to choose from. And that's where, perhaps going to a solo office where the dentist is going to be retiring, and it's just really a matter of them selling a clinic, 100% of it, that may be a better fit for you if that's what you're looking for.
Well, I think also it could be that a dentist may choose a DSO depending on what their personal goals are at different times in their career than a different dentist with different goals. So, and there also are ways of acquiring leadership skills, which can involve education, which can involve volunteer work, where you rise to the challenge of a leadership position and so on. I mean, you can transfer those skills into the clinical environment as well. So I was thinking, perhaps some dentists may start with a solo practice and look for mentorship, one-on-one with the solo practitioner. They may move into a DSO with the goal of eventually buying in and making sure this DSO offers that opportunity for them. Others may be looking for an associateship in a DSO that provides educational opportunities right out of school, right after they become registered. Perhaps for them, they're not really thinking about ownership immediately. They're not sure what their long-term goals are, but having more control over their schedule, having the support of the larger organization that actually can show them some business systems and so on, right? Might be a good place to be. So what do you think about that sort of a?
I think you nailed it. I think it highly depends on what career and life stage you're in. And it's really fluid, right? Because you could work for a DSO affiliated clinic while simultaneously working for a solo practice where the principal dentist may be looking to retire in the next 10 years. I think with a lot of the newer grads, what attracts them to the DSO model is this notion that a lot of the large DSOs have a training institute and they're able to heavily subsidize the continuing education courses that you would be required to take anyways, because you may not be confident, say, in implant dentistry. And so it's very attractive for them to get training from these professionals, right, more senior dentists. The one downside that I've also heard is if you go into a clinic where you're the only dentist, that may not necessarily give you, obviously, the greatest mentorship opportunity, because you may feel like you're on an island. And so even if you're being pulled out of that clinic, let's say a couple of days a month to go get training in an institute, you may still find that you need that hands-on help and guidance. And so one of the questions you want to ask the DSO is, the clinic I'm going into, who else is going to be working there, and what is their experience level? Am I going to get paired with a more experienced dentist, right? That I can call on, and they can even come over if needed in order to bind me out of the situation that I may be in.
I'm really grateful to you for including in your answers questions that dentists can ask at the interview stage, the advantages of working for a DSO at different stages of the career, the way to succeed in a DSO affiliated clinic, and in that environment in terms of what the skills are that they're looking for, and so those are the skills that a dentist can set about developing. I'd like to thank you very much for the time that you've given us today. It's been a really wonderful conversation, and I'm grateful to you.
Thanks so much, Lesia. Have a great day.
You too.
Bye-bye.
Bye.